You think a dentist and an orthodontist are basically the same, right? I used to think that too. But here is the twist, Dr. Esma. What if I told you that choosing the wrong one could literally change your smile forever? Most people walk into a clinic without even knowing who they actually need. Dentist, orthodontist, it sounds simple, but it is not. And the shocking part is, nobody really explains this clearly. Why is that? Why are they not telling us?
Rasim, that is exactly the problem. People assume all dental professionals do the same thing, but they do not. A dentist focuses on overall oral health, while an orthodontist specializes in aligning teeth and correcting bite issues. Sounds simple, but the consequences of misunderstanding this can be serious. You might waste time, money, or even delay the right treatment.
Wait, so you are saying people could be going to the wrong expert for years without realizing it? That is wild, and I bet there are even more hidden differences we have never heard about. Things that could totally change how we choose our treatment. Let me guess, Dr. Esma. Someone feels a little pain, Googles it, and just books the first dental appointment they find. Sounds familiar, right? But what if the issue is not just a cavity? What if it is actually a bite problem slowly getting worse? And they do not even realize it.
Exactly, Rasim. I see this all the time. Patients come in thinking they need a simple treatment, but the root cause is something only an orthodontist should handle. For example, headaches, jaw pain, even uneven tooth wear can come from alignment issues. But since the symptoms are not obvious, people ignore the real problem.
So they keep fixing the symptoms, not the cause. That sounds like a loop you cannot escape from. And the scary part is, time just makes everything worse, right? Now this is where it gets serious, Dr. Esma. We are not just talking about straight teeth for photos, right? This actually affects how people eat, speak, even how confident they feel every single day. I mean, imagine thinking everything is fine, but your bite is slowly damaging your teeth without you noticing.
You are absolutely right, Rasim. I had a patient who kept breaking the same tooth repeatedly. The dentist repaired it multiple times, but the real issue was a misaligned bite. Once we corrected the alignment, the problem stopped completely. That is why understanding the difference matters so much.
So one wrong assumption can lead to years of repeat problems. That is actually scary when you think about it, and most people never connect the dots until it is too late. Okay, Dr. Esma, give us some real background here. When did this separation even start? Because to most people, it still feels like one job with two different names. And clearly, that confusion is not random.
Great question, Rasim. Orthodontics actually developed as a specialized branch because alignment problems became more common with modern diets and lifestyle changes. Today, studies suggest that a large portion of people have some level of bite misalignment, but many never get evaluated by an orthodontist.
So statistically, a lot of people walking around right now might have a hidden issue and not even know it. That is actually more common than people think. Alright, Dr. Esma, now I want the science behind this, because this is not just about straightening teeth for looks, right? There is something deeper happening inside the mouth. What is actually going on when teeth are misaligned?
Great point, Rasim. Scientifically, it is all about occlusion, how your upper and lower teeth meet. When that balance is off, the forces during chewing are uneven. This can lead to microdamage over time, like enamel wear, cracks, and even stress on the jaw joint. Orthodontists are trained to correct these force distributions, not just the appearance.
So basically, it is like your teeth are under constant pressure in the wrong direction every single day. That makes it way more serious than people think. Alright, Dr. Esma, let us fix this confusion once and for all. If someone is watching right now and thinking, what should I actually do? Where do they start? Because clearly guessing is not the way.
Exactly, Rasim. Step 1. Always start with a general dentist for a full oral checkup. They evaluate your overall health first. Step 2. If there are signs like crowding, bite issues, or jaw discomfort, they refer you to an orthodontist. Step 3. The orthodontist performs detailed analysis, like x-rays and bite assessment, to create a targeted plan.
So it is not about choosing one randomly. It is about following the right path, step by step by step. That actually makes everything way clearer. Okay, Dr. Esma, this is the part people really need. What should they absolutely avoid doing? Because I feel like this is where most mistakes happen, like waiting too long or just assuming it will fix itself.
You are right, Rasim. First, do not ignore early signs like jaw clicking, uneven teeth wear, or difficulty chewing. Second, do not jump into treatments like braces or aligners without a proper diagnosis. And very important, avoid choosing clinics based only on convenience or quick results. Orthodontic treatment requires planning and expertise.
Those shortcuts can actually make things worse instead of better. That is something people really need to hear before making a decision. Alright, Dr. Esma, let us bust some myths, because I know people have a lot of wrong ideas about this. First one, braces are only for kids. That cannot be true anymore, right? I see adults everywhere starting treatment now.
Absolutely, Rasim. That is one of the biggest myths. Orthodontic treatment works at any age if the teeth and gums are healthy. Another misconception is that straight teeth automatically mean a healthy bite. You can have straight-looking teeth but still have functional issues underneath.
That is surprising. So even if everything looks perfect in the mirror, there could still be a hidden problem. That is something most people never even question. Alright, Dr. Esma, let us make this super practical. If someone is watching right now, what is a quick checklist they can follow today to avoid making the wrong decision? Something simple but powerful.
Perfect, Rasim. First, check for warning signs like jaw pain, clicking sounds, or teeth that do not meet evenly. Second, book a general dental exam and ask specifically about your bite, not just cavities. Third, if anything seems off, request an orthodontic evaluation early instead of waiting.
So basically, be proactive, ask the right questions, and do not wait for pain to force you into action. That is a game changer right there. Dr. Esma, I love real stories because they make everything click. Do you have a case that really shows how this confusion plays out in real life? Something people can relate to instantly.
Yes, Rasim. I had a patient in his early 30s who kept visiting different dentists for sensitivity and minor fractures. Each time the tooth was repaired, but the issue kept coming back. When we finally evaluated his bite, we discovered a deep misalignment causing excessive pressure on one side.
So the real problem was never the tooth itself, it was how the teeth were meeting. That completely changes how you think about treatment. Dr. Esma, where is all this heading? Because it feels like dentistry is changing fast. Are we moving toward a future where this confusion disappears or gets even worse? I see all these digital tools popping up everywhere.
Great observation, Rasim. The future is actually becoming more integrated. Digital scans, AI-supported diagnostics, and personalized treatment plans are helping dentists and orthodontists collaborate more closely. This means patients will get more accurate diagnoses earlier, and the right specialist will be involved at the right time.
So instead of guessing, technology will guide the decision. That sounds like a much smarter and safer future. So here is the big takeaway, Dr. Esma. It is not about who is better, it is about who you actually need at the right moment. And most people are just guessing. That is the real problem we uncovered today.
Exactly, Rasim. When you understand the difference, you make smarter decisions, avoid long-term issues, and protect your oral health properly. A simple check at the right time can save years of complications.
So if you learned something new today, do not keep it to yourself. Share this with someone who might be making the wrong choice right now. And tell us in the comments, have you ever been confused between an orthodontist and a dentist?